In our Mental Health Monday reports, we've looked at police response to folks in serious mental health crisis and followed our frontline heroes as they cope with the stress of the pandemic. But tonight, we want to talk about you. How do you know it's time to talk to a mental health professional, and what can you expect? It's not as complicated as it sounds, and in most cases, it's a quiet, confidential, non-judgmental conversation. Maybe the most striking feature of the state's Greenville Mental Health Clinic is how ordinary it looks, like a doctor's office inside a library. It's quiet, low-key, and hopefully a good place to talk.
You're not committing to anything except I want to come in and talk to somebody and see where I stand and what may be available to me.
Most meetings here at South Carolina's Department of Mental Health begin with a therapist and a conversation, usually for about an hour. It's so easy, the state now promises to see any new patient within a week of first contact.
People often get concerned that they're going to, they say the traditional things like, well, yeah, I've got some problems going on, I've got some stress, but I don't want people around me to look at me differently or, to think I'm crazy.
Which of these objects are solid?
For school kids, finding help can be even easier. There's a trained therapist in every Greenville County school who treat the kids, their teachers, and yes, the parents if they ask. Again, that's the hard part.
Nobody wants to admit that they're going through a difficulty, especially to someone they don't know. We worry about being judged. I'd want you to know that when you call a therapist or somebody who's here to help you, they're not here to judge you or label you. They're here to help.
The real key is knowing you need help, not necessarily medication or inpatient care, just a place to go when stress or trauma, anxiety or sadness interferes with daily life for people who lately have more bad days than good.
So everybody has good days and bad days, right? And so just because I have a bad day doesn't mean that I need to seek care. But if I find myself having more bad days than good days, and I'm either feeling sad more frequently than not, anxious more frequently than not.
For many, these state offices may make financial sense. They accept Medicare, Medicaid, and most private insurance. For private care, it may be better to ask your family doctor to refer to an in-network therapist. There are some that only accept cash. But again, therapy is an easy start. Someone whose only job is to listen without judgment.
Everyone has mental health, emotional health needs and struggles at different times. That being proactive and talking is like the medicine for dealing with those things. It's how we heal and how we get better.
They're more available than you might think. It's easier to engage, and there are more people who need that than you might think.
Here is a very easy way to get started. Statewide, toll-free number for folks who feel anxious or depressed right now, 844-SC-HOPES. That number can help you find the right resource near you. There are a ton of options, including telehealth for folks who may not want to see somebody in person. There's nothing wrong with asking for help.